Some say it's the saddest day of the year. On January 20th, we mark Blue Monday. You've heard about it before. And while there's no real evidence to suggest it is the most depressing time, experts say there is truth to the impacts of changing seasons like a dark winter on our mental health. With more on this, we're joined in studio by Dr. David Conn, a geriatric psychiatrist with Baycrest Health. Thank you so much for coming in. Okay, so we're not being dramatic. There's a reason we feel the way we feel. Explain that to us.
So a lot of people notice a change in their mood during the winter, and this is a typical time now in January. We've had a couple of months where there's very little sunlight, and it's post-holiday season, and people are a little bit more likely to become socially isolated after the excitement of the holidays, or for some people, the disappointment of the holidays.
Yeah.
So there's a lot of factors that seem to come together that predispose us to having a bit of a dip in mood, and not just mood, but energy. So many of us have less energy. We want to sleep more. And sometimes you want to eat more, and not always the best of foods, the healthiest of foods.
Yeah, and you mentioned seasonal affective disorder. You talk about how this impacts people. So you're referencing the weather here plays a huge role on people, and it's because we don't see that much sunlight. I can't remember the last time that I did see some sunlight here in Toronto. But how can people overcome SAD, as it's referred to?
Sure. So one thing that's important to differentiate is just the regular winter blues that many of us have, and it's relatively mild. And then some people get a much more serious depression that may need treatment, and that's referred to as SAD, or seasonal affective disorder. And if a person's noticing like really serious depression that comes on in the winter, they should consult their healthcare professional, because there's some really excellent treatments for that, including bright light therapy. There are these light boxes that people can use every morning. Now that's more for people who have that as a disorder, but it can be a very effective treatment. Just half an hour a day, every morning, in front of one of these specific light boxes, and that can make a huge difference to individuals who have SAD.
Do you need to be diagnosed with it, or is this something that you can go do yourself?
Self-diagnose. Yeah, usually we would suggest that you see a healthcare professional and discuss it with them if you're going to embark on some kind of treatment. And again, if someone has a serious depression, there are other treatments too, like psychotherapies or even antidepressant medication that may be indicated. But again, most people, I think, have the more mild version of the winter blues.
Right.
And there's a lot of things that all of us can do to kind of deal with that, with those changes in mood and energy. Okay,
so you mentioned light therapy. What are some of those other tips you have for people? You and I talked a little bit about getting out there, getting outside, getting fresh air does help.
It does. And even on a cloudy day, if you can actually go out and get a walk, that is really, really helpful. And physical activity of any kind, it could be exercise, but just getting out there and walking is good. Dancing is wonderful. There's also psychological components as well. So for some people, dealing with their stress at this time of year can be really important, which for some people could be doing yoga or meditation, or just being good to yourself, self-talk, positive talk. And another thing to mention about this is maybe we should be kind to ourselves and say, okay, we may want to hibernate a little bit in the winter. And that's okay. Maybe we need more rest at this time of year. The other thing that's really important is social connections. Yeah,
I wanted to ask you about that, because there's so many serious components to this too. I know we talked a little bit off the top about, listening to our bodies and whether or not we're being dramatic about the way we feel, but there are a lot of serious components to this. You mentioned a couple here. Loneliness is something else, and you mentioned because people are hibernating more so, maybe not as social as we can or should be.
Exactly. So social isolation and loneliness are very important in terms of our overall health, both physical health, mental health, cognitive health. There's remarkable studies now showing that people who are chronically socially isolated or lonely have worse outcomes. For example, 50% increased risk of dementia. So we're doing a lot of research in this area, hoping to prevent dementia in the long run. There are many solutions to this. But in terms of coming back to the blues and the winter blues, so for many people, you know, there's this tendency to just want to stay on the couch, but
Yeah.
it's really important to go out there and connect with your family and friends and be proactive about it.
Yeah.
Because that can make a big difference.
Yeah, I know. You know, I feel like you're personally speaking to me because I am tied and glued to my couch, but I try to make some plans, especially during the winter months. It's so important to be able to connect with all your loved ones. You gave us some great tips there. Anything else you wanted to add as Blue Monday approaches?
No, I think, again, that people should think about themselves as an individual and the factors that might be contributing to their blues.
Yeah.
And then get help if they need it, but otherwise try to make some positive changes.
All right, awesome, great tips. Dr. David Conn, thank you so much. We are ready to take on Blue Monday. Thank you.
Thanks so much, Faiza.